take care for your child.
Mm-hmm.
I help you today?
Sorry, what did you say?
How can I help you today?
Oh, it's my child. I would like to know what's going wrong with him because somebody say that he has a big problem now.
What's wrong what's wrong with him?
That's why I ask you.
Um, please tell me something about your sign.
Okay, now I bring my son to the hospital because recently he lost his appetite. He doesn't like to eat. He doesn't like to play, and he eat very little. And sometimes he's sweating, and sometimes he has a nose bleeding too. So I don't know what's wrong with him. So I bring him to your hospital, and you do some blood tests for him, do something, and then up to now, nobody say to me anything. So I would like really to know what happened with him.
Okay, okay, keep calm. And now I want you ask me some questions.
Mm-hmm.
When did it start?
Looks like it started a couple of months ago, but it's not real. It's very vague and it's not anything clear cut at all. But recently, just about 2 weeks ago, it looks like he looks so bad. Yeah? He doesn't like to play. He doesn't like to eat. Okay, and he has a nose bleeding. Sometimes he has a fever. Okay, that's a problem. It's a main problem. Otherwise, I don't know anything else.
How long has it lasted?
How long?
Yes.
Yeah. How long for what?
How long did it last?
He feel your son feel tired. How long?
Okay. Okay. I repeat it again. Huh? You didn't catch what I say. Okay. Okay. It takes a couple of months, but it's not very clear cut. And just recently, about 2 weeks, the condition is become more and more worse. Okay, it's deteriorated. So that's the beginning. I really don't know, but recently, about 2 weeks ago.
Their symptom is constantly or just in time.
Mm-hmm. What did you say again?
This symptom is presenting or just come and go?
What kind come and go and what kind presenting?
Tired and nosebleed and fever.
Okay, he feel tired, he feel fatigue. It's because it seems as more and more. Before it's not clear, but now it's more and more. That's why he doesn't want to play. Children, they always playing around here, but now they stop playing. So I'm very concerned about that.
What anything else? Example, did he have cough, rash, or vomiting, or pain anywhere?
Oh, thanks God, he doesn't have that one. Yeah. Okay. That's all. I saw that he has some. Could you? I already told you. So you remember what I told you?
Yes.
Yes. What is it? Please.
Your son is tired, and
Yes.
sometimes he has fever.
Yes.
He has nose bleed.
Yes. Yes.
And now it's worse.
His condition become worse and worse.
Worse and worse.
Yes. So what will you do for my son? how do you think about what condition? Now, I really want to know that what's happened to him.
Your son have some problem in health, and now
Yes.
I will test some tests for him. I will I need have I need draw some blood.
Yes.
To do test.
Yes.
And
So how long does it take for me to know what's wrong with him? Okay. Yeah, I'm willing to let you do the blood test for him, but how long? You can answer me.
About 2 hours whenever is research of blood test. I will tell the next step we do with your son.
But how long? Okay. I stop here. Okay. I may be a very difficult patient, family members for you. But you know, ask the parents. They always worry about their children, about their children's condition. So that's why when you explain it, you should explain very clear and don't lingering. To you should know that your job. Okay. Now, Dr. Do, Dr. Khuyến, and Win and Sarah have any ideas? Okay, it's my job here. Okay, it's finished.
Well, so first of all, I'd like to tell you guys this. In this assignment, you ask the HPI, history of person illness, and this is week 6. Remember, we talk about occurred. How do you get symptoms from the parents? So let me go back and review. So you did ask about onsets, but you did not specifically say about characters. And then extrusive symptoms, you talk about fevers, and then relieving factors and temporals. So my point is, I mean, sometimes in a situation like this, and Dr. Dean is very typical parent, I can tell. I'm sure he's a top parent. That's why he tried to intimidate you, and that's why you guys but that's real life. Remember that there's a lot of parents, they come to see you, they're so anxious, and they just want to tell you, sometimes they're over telling you a story. They tell symptom that, because they don't experience the symptom, but they see their child, so they tell you, they kind of over telling a story. So your job even more difficult, right? So let's try to grab up this section with HPI because we need to move on. But I'd like to tell you this, speak slowly like you do, and try to go back to, because throughout the next 6 weeks, we always go back to overcut. Remember, if you don't know anything about leukemia, watch movie, okay? Korean drama is the best one. Vietnamese too. Young, beautiful girl suddenly die. So what symptom? Well, nosebleed, right? And then so remember, those type symptoms: weight loss, fatigue, tiredness. In real life, actually, a child with leukemia, they have B symptoms, include weight loss. As some of you should have asked, weight loss, bone pain, gum bleeding. This is one of the very common one, and skin rash, very common in child. So remember, ask those questions. But try to stick with something that you really hate or you really like. Like the way that I remember, it's Cao Thái Sơn. You know, he has one MV come out just lately called Người Cũ Còn Thương. He has leukemia, but to me, he's the best leukemia patient because when he died, he in perfect shape. You know, no skin rash, no gum bleeding, nothing else. So think about it. So think about how real life is and how is your patient, and that you ask those questions. All right. So let's keep moving, and you two not finished yet because I will ask you to come back later, okay? Because today you just finished just half of your job, so be ready, okay? And then I will bring you back. Dr. Do, you just come today. Any comments?
Yeah, I went through the, I can see myself in you guys when I first start out with the medical history. I focus a lot on what question I'm going to ask next instead of what the patient said. So sometimes I forget what they said. So the way for me to make things easier with the difficult patient is I do this. I said, let me summarize what you told me so far about your kid. Your kid has a fever for this long, for this much, with this symptom. What bring it? Just like kind of like summarize what the patient said, and then at the end I said, anything else you would like to add, and that will also allow them to fill in what am I missing. So it's also easier. You don't misinterpret, or you don't add or subtract anything that the patient said, and it makes them easier for you to get more time and organize your thought. That's my approach for these difficult patients. That's it. Yeah.
mà răng hai bọn em lúng túng vậy thì cứ SPI mà thà để lại nói tới thôi sao ít symptom. Yeah. Ít symptom. Follow each symptom mấy cô bệnh. Follow all part. Step by step, one by one.
No Vietnamese, please.
Confused about it. So the next are again with other team.
Yes.
Okay,
so you two will hand out. Let's go back to your seat, but you come back here with more.
When said that, you will be come back. You will come back later, and the next turn.
Yes, the next couple who would do. The next task would be explain about lab test, like what you're going to do. Okay.
Yeah, right. Đợi cái ghế này chị.
And by the way, Dr. Mindo, we have two Dr. Do here, so we have to be specific here. Dr. Mindo is an internist from Texas, and one of our long-term teacher here. So Heinemann, we have Dr. Do, another Do here. So okay, you guys are Dr. Do, double right here. Dr. Kringle is a cardiologist at USC, and one of my colleagues too. So he interested in this, and then he come out and see. All right.
The big dough, and little dough, or small dough.
All right. So next one is this couple on this team. I call team 2. Okay. So this time I will be your patients, and I'm a mom. Okay. Try to think about as I'm a mom. And I have my 8-year-old daughter. Like I have symptom of my daughter fever, shortness of breath, gum bleed, and then weight loss. So you want to tell me what are you going to do next in terms of labs? Okay, ready? All right, doctor.
Nice to meet you, madam. Can I help you?
Okay. Well, I'm Sarah. I'm Jessica's daughters. No, I'm Jessica's mom. I'm here because they told me to see you guys, and then you tell me what to do next. But right now, I don't know what to do. Somebody told me that my daughter had cancer, and I don't know. So help me out.
Calm down. Calm down. My name is I'm Dr. Chang, and here Dr. Yong. We will help you today. Don't worry.
Okay.
Yes.
All right.
Can you tell me? Can you tell me what problem with her?
Well, she has symptom of weight loss, fever, very weak, and she have some gum bleeding and also some skin rash. So I saw one of your doctor here, and he told me that Jessica needs some blood work. So I'm wondering what test should she receive, because I just Google it. It sounds like she needs a lot of work.
When did this problem start?
Oh, it started for several weeks ago. So what lab or what blood work that should Jessica have?
Which symptom have appeared first?
Well, initially she told me that she may have some bleed from her nose. I thought that's just a normal nose bleeding. That's happened about 6 months ago. But lately she has a lot of bleeding. And that's why they told me that my daughter, she could have cancer. And so what blood work I should do?
Okay. Have you go to see the doctor, another doctor, or use medications before?
No, I don't think we use any medication yet.
Have you draw blood before?
No.
Okay. Now we make a blood test for your daughter.
Okay, is it painful?
Don't worry, just a bit. It's like an ant bite.
Really? Jessica doesn't like ant bites. She hates it.
But we have to do some tests to exactly diagnosis.
I understand, but can we minimize that? Can we just do a little bit, just some, okay, just some blood, okay?
Yes, about 5 mil.
5 milliliters.
About 5 mil.
Okay, I'm very bad at math. Tell me how big is that compared to a Coca-Cola or a regular diet, a Coke?
But I want to ask you some questions. Did she have a tumors before?
Does she have a tumor or what?
Fell down.
Oh, does she fall? Does she fell? No.
Did she have some medicine, some disease before?
You mean dizziness? Oh no. Well, I'm asking about lab work because they told me that my child will have X-ray, my child will have CT scan. I mean, it sounds like there's a lot of tests, and some of them they suggest a skin biopsy. What the heck is that? Because she has some skin rash. Does my child need to have an X-ray?
We will do blood test.
Okay. All right. Do you think Jessica needs an X-ray?
Some X-ray.
Can she not do that? Because I heard that X-ray is very bad. It's radiation. It can cause cancer. So can we not do that, right?
It's nó là có thể gây X-ray has useful to diagnosis. I know it have some advantage, but
it's a little. It's a don't at fast more.
Oh, okay. All right, so you going to take a very little blood from Jessica. You promise me, okay? And then no X-ray.
Yeah.
Is that good? Then is that okay?
I, if you worry a lot, I think you can. I suggest you must MRI.
MRI of
Yeah.
what? Where?
It can find some tumor if they have a.
All right, so guys, let's time up here. I think we confusing about today's topic. Let me remind you, the assignment is we talk about leukemia. It's the topic today. The first two persons take history. The next two persons that you are right now discuss about lab and tests, and you explain to me what lab are you going to do, and then the next team will talk about bone biopsy or marrow biopsy, right? So we go as in sequence. You don't have to go back and ask me about the HPI because the previous team supposed to be done that already. Your job with me right now is explain to me what are blood tests, how much blood you need to draw, does X-ray necessary, any CT, any skin rash, does it need biopsy. You as a doctor explain to me in a non-medical term, what are they? Does it make sense?
Yeah.
All right, so let's do it again, because I like to make sure that the entire class we clear on this, right? This is a team effort. It's like we talk about just one disease with one patient today, but in different steps by different team from the very beginning to very end. And that's how you, to the entire class, it's just one team today. Does it make sense? Okay, can we resume? All right. No. You tell me more now because okay. So doctor, tell me about blood tests. What is that? So you said you draw blood from my daughter, from Jessica, and what you use for what?
Blood test. We will.
First, you bring your daughter to life
laboratory department, and the nurse will test some blood, draw out the vein. So we will take it. We will take it to.
She will test draw his blood about 5 ml, and she will give you an alcohol cotton, and you put it down on his blood taking site, and it has stop bleeding here, there, and you wipe you will wait for results of blood test about 2 hours.
Okay.
And, after that, you bring her, and the results come back here to see me.
Okay, but doctor, I'm worried because my daughter, she bleeding from her gum. Now, if you draw blood from her arms, would it continue to bleed from there?
Don't worry, it's just a bit.
Did you have one?
Small amount, and don't affect anymore.
I see. Well, I'm asking you, doctor, did you ever have someone draw blood on you?
The wound is very small because we take blood throughout the vein when we will use a siren to test it. So it's very, very small.
I see.
But we have to to take blood, to take some ingredients to now normal.
I see. So are you going to what are you looking for in those blood? What are we looking for in Jessica blood?
We can now red blood cells to now this they have anemia, some white blood cells. So now this here have a infection or some platelet to check if he have a lower platelet. It can it may be jump leak.
How about X-rays? You think Jessica needs a chest X-rays?
What do you say?
Does she need an X-rays, a chest X-rays?
Yes, it is a normal test to find out if she has a tumor.
Because she have a bone pain, so we will have a X-ray, a special bone X-ray where he bend, where she bend. It can find some abnormal such as tumor or some.
All right. So let me stop right here, and I'll let feedback from Dr. Mindel and Sarah to see, and I like to you guys think about, and my class too. I like the class think about what they did well and what they did not do well, because I want the entire participation from the class. It's not just the 2 person come up here. Okay, Dr. Mindel.
Yeah. I think the two up here. Can you hear me? Sorry. Yeah, I think the two up here. You seem like you do prepare for your answer, but sometimes you may also pay attention to the reactions or the question of the parents. Sometimes Dr. Huynh ask you some question and you just ignore it and keep going on, and sometimes people just have one thing in their mind, and if they don't get the answers from that, they won't listen to anything else you say. So yeah, be responsive. If you get a question from the family, either you acknowledge that and say that, okay, I will let me finish this point and I will come back to that. Or if you can answer by a short answer, then you should address it directly. Yeah, because sometimes ignoring the family questions is not a good idea, because they won't listen to whatever you try to explain next, and it's really waste your time and your effort. The second thing is, you sometimes I think you try to explain what you know or what you understand, rather bring it to the level of the lay person. Just like Dr. Huynh just try to tell you like 5 cc or 5 millimeters, how much is 5 millimeter, the needle stick on the kids, how is it, yeah, try to make it simple, easy to understand. Families, lay people, they don't need to know the details, the technical, the medical details of your explanations. Just the very basic, easy to understand information that what they want. And this is not like checking your medical knowledge. No, it's just how to interact with the family. That's the goal today.
Well, by the way, I just want to acknowledge now we have triple Dole. Actually, Dr. New Dole just come. She's a pediatrician from Dallas. Oh my gosh, today it's the Dole family. Dr. Fing Dole, he's a cardiologist from USC. Dr. New Dole, pediatrician from Dallas, and Dr. Min Dole, internist from Dallas. You guys dominate this class. Okay. Continue, Sarah or
we should call them by first name, okay? Don't call the last name anymore. It just make me confused.
Yeah, it's a way confusing now. It's too many. Okay. Other comments, Sarah?
Yeah, like I second Dr. Min review. Like you guys prepare well. You guys try to explain to the mother why you need certain tests, but I think you guys so nervous that you guys like switch to a student mode. You start like reciting the knowledge rather than explaining it to the mom. So like just relax a little bit, explain it in a lay term. Don't use any like terminology like anemia, anything like that. So try to explain it as simple as you can. And there's a little like there's some pronunciation that you guys can correct, like lower is not lower, it's lower. Lower is like making the noise louder, not like lower. Okay, and a few words like that. So, but overall, I think you guys like give a good effort. You guys did you guys try really much. So,
all right. So now it's time for you to explain, or you can say no, I disagree. I did a really good job. You guys don't understand me. I like your feedback. Okay, so tell us.
Thanks everyone for comment.
Okay, that's a very nice explanation. Okay, okay. As I say, we are the week 6. Okay, as we move forward to the end, I will be very difficult, and I expect you guys become more comfortable. And in medicine, it's okay to argue, but as long as we're professionals, and that's fine. Like when we argue with the cardiologists all the time, or with pediatricians all the time, as long as we still respect each other. So make sure that you guys, if you disagree, just say, I think this, okay? Because this class is all about interaction. For my estimate so far, the majority of talking actually from our side, like me, Dr. Jin, and Queen, and then Min. I'd like you to talk more. Think about it. You spend a week, you do a lot of time to prepare. So come here, talk, okay? That's the only goal of this class, and that's for you, okay? So I give you guys a second chance. Just go to the back, and whenever you see something wrong, just raise your hand. Say, hey, I have an idea, or this is what I think, okay? I like a fully active, no sleeping, nobody look at the phone, no, this is your time. And we, as I said, we like every second here, you guys learn something, okay? Cool, let's move on to the next one.
Okay, before we keep going, I would like to give you some little feedback here. First one, I would like to tell you that you should pronounce test correctly, yeah? Because it's a history in Vietnam. Usually test, we call that something, okay? Now try, put the S in there, test, S and T, okay? Not tat, okay? I heard a lot of people just say that tat, okay? It's not correct one. So please, practice it. Number 2, about the blood, you tell that you draw the blood Okay, you don't say that you take the blood. Okay, the take the blood, people can understand you, but draw the blood is a correct word you have to use. Okay? And about the blood test, you just don't say that about white blood cell, red blood cell. Okay, it's no layman, they don't understand that. Okay, you just say, oh, we keep a blood count, we count the blood. Okay, so that's make everything more simple and easier for the layman to understand. Okay.
All right. So move on to the next couple. The last thing I like to actually, I don't know. Tell me, in pediatric leukemia, do you guys still do blood smear, right? In Vietnam? Okay. Wait. Class, can I have your attention? Do you guys still do blood smear, right? When people with leukemia used to do that. And that's a very important test that you should explain to the patient. So, I mean, I was about to ask you guys that test, but that's okay. So move on to the next couple. Okay, next team. This one, you will explain to me. Actually, why don't you pick one of your favorite instructor here? And now we have we have Dr. Queen, Dr. Như, and Dr. Sarah and Dean. Why don't this team pick a patient? All right, Dr. Thuy, are you ready? Okay, so let me, Dr. Thuy, why don't you pick a patient, okay? You pick a team here, like who would you like to be your parents? And in this scenario, you're going to explain about a procedure, right? We talk about this, right? Bone marrow, in this case. So why don't you pick, actually before that, this is we talk about informed consent. You explain about this, right? So why don't you pick one of your favorite one? Who would you like to be your patient? Mendo. All right, Dr. Mendo, you are the lucky man. All right, I let you, okay, go ahead.
Yeah, so I am let's see, I am the father of Jessica earlier. Earlier you met the mother, now I'm the father of Jessica. I may know a little bit about medicine, so I'm kind of like a nurse, not a doctor, just a nurse in doing not clinical work. So I don't know much about that, but I know a little bit about medicine. So maybe make it a little bit more difficult for you to explain or convince me, because I'm gonna have some irrelevant medical questions for you. Okay, so doctor, I heard that my Jessica, she's sick, and you need to do some tests for her. What test you need to do for my Jessica?
Hi, Mr. Ming. I'm Dr. Liz. I'm her doctor, and today I will. Can you hear me? Hi, Dr. Ming. Hi, Mr. Ming. I'm Dr. Liz, and I'm your child's doctor. And today I will explain the test we will do for her. It's called bone marrow aspirations.
Oh, bone marrow aspirations. Yeah. I think I know about that. You're gonna use a big needle to stuck into my child, right?
Yes, but but before doing the test, we will apply numbing cream and give her a medicine, and so she draws it.
Numbing? You think it's enough,
I
doctor?
think it is very, very painful and stressful, but however, I have a special doctor to give her deeply sleep. So while we do procedure, maybe she maybe know nothing. Just a little
So
bit
you,
when she woke up, it's a little bit pain.
so you're gonna put her to sleep? She will not feel anything?
Yes.
Oh, so, but you put my child into sleeping, so just like the surgery, right?
No, simply for the surgery, because we just use some medicine for her IV. Yeah.
Okay. But is
Just
it dangerous, doctor?
yeah, just for sedative already.
Okay, but is dangerous, doctor? Put people to sleep. Will she ever wake up?
I think absolutely any procedure have a risk, but we have to some equipment to monitoring her and
Okay.
to control everything.
Okay. But then, doctor, this procedure is really important. I heard you have CT scan. Can you see it through CT scan, doctor?
You know, she had done already, and now he finding. She had a blood test. She had a check it right and MRI already yesterday. You forget it, and now here we have on finding. And the last procedure, we will have to do the bone marrow aspiration.
Okay, but this cannot just through the vein, doctor. You need to go inside the bones. It sounds really painful to me.
Yeah, maybe I will explain a little bit more. You know, in the blood system, when we are finding that there is some uncomfortable, some abnormal in her blood, so that's why we will have to do this procedure to find out the organ which product the blood cell.
Okay, so there's no other alternatives, no other options besides this.
Yeah, this is the last one we will do before we decide what kind of the causes of her disease now, and to give the exact treatment for her. I think it's the best way until now.
Okay. All right. I think yeah. But then another question. So anything dangerous on this procedure, doctor? Whether it's my child gonna get infected, it's get into the bone.
Yeah, you're right. There is some complication after doing, for example, delay bleeding, infection, or maybe sometimes there is some damage around area. But we try my best to control the infection condition, and we have expert nurses will follow up her for the delay bleeding.
Okay. You seem very experienced, doctor. You do many cases like this before. You do many biopsy like this before.
Unfortunately, we have a few. We have many patients in our department, so I have done a lot for them. Yeah, unfortunately.
Okay, doctor. All right. Yeah. I think I trust you to take care of my child. But can I be there when you do the procedure for my Jessica?
I think it's better if you don't see, but if you would like, because you have some knowledge about medical, and I think that's right if you want to see.
Okay. Anything else you want me to know, doctor, or anything you think I should know, doctor?
Yeah, you should decide right now. But if you have more time, I will let you some 5 minutes. And when you are ready, let me know. And before we conduct this procedure, you should sign on the informed consent for us. Right?
Okay. Okay, so this informed consent is that if anything wrong with my Jessica, if she have something bad, then you guys gonna go free, right? You have no, you off the hook, right? Is that what I gonna sign here?
Yeah, so that's the way I will let you 5 or 10 minutes. You just read through and think more about that. And if you have any more questions, I will explain more for you. Because this is the last and the best thing I will do for your daughter, for your daughter, yes.
Okay. Okay. Yeah, and your colleagues, the doctor beside you, will she participate in the procedures too?
Yes, she my assistant, and she just do for some case, but in this the case, because your daughter is quite young, and I myself do it, and she will support me.
Okay. Okay, I trust you, doctor. Your colleague seem very quiet and very young. I don't know she experienced enough. Don't let her touch my child, okay?
Don't worry. Yeah, you know, because I always teach her, and normally I let her do the easy case for normal children with a normal weight, too easy to.
Okay, doctor. I trust your knowledge and your skill. I trust your child in your hands, and my child in your hands. So, thank you, doctor, for take good care of my child. Where should I start, doctor?
For your delivery, me.
Okay.
All right. Well, so let's go back to you and Queen. Let you guys give comments.
Oh, this is Queen. I think you did a great job of explaining the risks and benefits, and also, you know, it's very nice job of reassuring the patient. You know, I do a lot of these consent, and I think you did a great job. One thing in my experience to help the patient more ask less question or know more about procedure is I describe exactly what I'm going to do. Like, I'm going to clean the area with antibiotics. I'm going to use some local lidocaine, use a needle to and maybe in some case use ultrasound to target, you know, a certain area. And also it's also helped to tell them, you know, the recovery process. So some people feel that as more reassurance. I just explain to them every patient exactly all the steps that I'm going to do, what to expect it, what are the risks, what are the benefits, and that will reassure them more and let them ask less question. And also the other thing is that if you explain all those steps in the forefront, they don't jump around and ask so many different questions. But I think overall you did a great job of explaining and reassuring the patient. And when the patient asks you about, you know, do I need to sign this paper for you to do the procedure, you can say that, you know, is our hospital protocol that all procedure require permission. And also one other thing I tell them is that I tell you all these complications, but it doesn't mean it will happen. And I tell every single patient, I tell the same thing, just to make sure, you know, down the line there's no question. But I think overall you did a great job of explaining the procedure. That's it.
So I have an idea. So the time of informed consent, normally we take it not only right there before that, but sometimes we can also talk with the patient maybe one day before, because the schedule not always right there. The schedule has to be 1 or 2 days before, you know already. So the doctor will come and talk with the parents maybe 1 day before. And then after that, when the procedure days, they will do it again to see if the patient have any other questions. That's what I think. So the second thing is the pronunciation. I think that we can have some kind of Google, and then they have some sound that you can, I think I use something like a Google definition, any kind of thing that I don't know how to pronounce, I will Google it and put definition in there. They will pull out some window and they will sound it for us. So I will learn from them. That's what I will do. So you can do the same. Yeah, that's it. But is a good one, and value, like a lot of information.
Thank you. So Andin.
Okay, I just want to emphasize about the consent again, because in the practice, when Dr. Mindo asked you that maybe the parents have to sign the consent, so you may be off the hook or something because he suspects that something wrong there. So you cannot answer that, oh, I give you 10 minutes to think about that and sign for me, okay? The answer is not appropriate at all, okay? So I would like to emphasize that. You have to explain, like Dr. Quyên already say, or Dr. Như, you have to give them time and you have to explain to them. Don't answer the question by something that not relevant to that at all, okay? You have to make the patients calm down. That's your most important job there, okay? Just about the procedure because my previous job is an anesthesiologist. So you see that you have two kinds of to relieve the pain there. Either local anesthesia or a general one. And I believe it's seldom we use a local general now, okay? And the work that you can use, you use numb to numb the skin is okay. But the best work you use is to freeze the skin, okay? Even it's not freeze at all, okay? But that's a correct work if we use a local anesthetic, okay? They have the patch, they have the spray, they have everything. They have the needle, but you just say that freeze the skin or something.
Okay, thank you very much, Andin. And I just want to acknowledge one more famous but kind of very exciting teacher come back today, Anh Phú from Australia. So I don't know, today we have a follow-up with our instructor. Anh Phú, we have Dr. Quyên Do, a new cardiology join us too. So yeah, I'm amazing to see many of you guys today. And Dr. Wang Phu Do is a gynecologist, obstetrician, and he's very famous with ông già khó tính. So moving on this class, we move to the second part, and this is now it's more difficult because you guys going to do a next job. It's you going to give a bad news. Okay, so you talk about the prognosis, or tell us about the diagnosis first, and then we'll talk about the prognosis later. So who is the next team? I just want to recap everyone. Today we focus actually only one case about a leukemia, a case of 8-year-old girl initially was diagnosed with leukemia, and she had initial blood work, now underwent a biopsy, actually bone marrow biopsies, and now those two doctors will discuss about the diagnosis. Why don't you pick, Dr. Wang Phu, could you be always Anh Phu?
Yeah, I think he has some problem with his headphone, so he's correcting it now, I think.
Oh, okay. Oh, he's back. Okay, Anh Phu, would you like to be our next patient, or you wait for the next round?
I'm sorry, I lost the screen. I'm not sure what the hell going on here. Yes. I try to work it on now. Okay, you go on. I don't see anyone here. Just I think I'm just too poor. I don't have money to buy the new computer. So.
Okay, when you have to make and fool the panelist.
I did. That's why he's in the screen right now. All right, so
I can't see. You guys keep going, and I can't find. I have to work out a way to try to get back in. Yeah.
Okay, sure. So let's keep going, guys. Why don't we go back and let's go. First one, let's go to Sarah. Sarah, are you ready to be a mom today? And then
okay.
With your daughter Jessica, they go on to tell you about the diagnosis. Okay, this is. I expect to see traumatized. Okay, so feel free to laugh. Feel free to laugh.
Okay.
Okay.
I see some tears.
Okay. All right, guys, keep going.
Okay. Hi.
Hi.
Hello.
Good morning, madam. I'm Dr. Yin. I'm the doctor of your daughter, Jessica.
Speak loudly, please.
Oh. Yeah. Okay. So, how's the test? How's the result?
As you know, we have done the blood test and the bone marrow aspiration for her. And now we have on-off the results for your daughter. Would you like me to explain the disease for you, mother?
Yes, of course, please.
I'm sorry to say you that Jessica gets leukemia. Do you know about this disease?
No. What leukemia?
It's a kind of blood cancer in children.
So my child has cancer?
I'm sorry to have to say you like that. But unlike adult, the leukemia in children have a more chance to live than the adult cancer.
So, but is it dangerous? Is my child gonna die? What's gonna happen?
You have to your daughter have to experience the treatment. Maybe it's last for so long, but the chance for your baby can live, can go to school is maybe other children they have the have the result of 70% of children have a chance to live.
Like, I don't think it's true. Are you sure that you mistake the? Could you be like? Could there be any mistake? Can you redo the test? Because there's no chance that my child has cancer.
You know that we have done a lot of tests for her, the blood cell, the bone marrow, and I'm feel so sorry that to have to say you that the result improve that your daughter get leukemia.
So so you are 100% sure that my child has cancer?
It's difficult to accept about the disease of your daughter, but I'm also hope that it's not true. It's not the truth. But done a lot of tests. We do the bone marrow. It's approved that there is not normal in your blood production. For as you know, she had a lot of symptoms such as fatigue and gum bleeding and loss of appetite. At first we think about maybe this is the symptom of malignant disease, and I really want to do another test for her, but but so hard to say that the results is like that, and we think that you have to follow with us to struggle for the disease of your daughter.
The doctor next to you seemed very, very unsure. So I don't know. Like, I don't trust you guys. How can I trust you guys? Prove it to me that my daughter has cancer. Can I have a second opinion? Can the second doctor say anything? Say something?
I think this news is difficult to accept, but please calm down, and I think you can more time to accept this news.
Okay, so was it something that I've done? Is it my fault that my child had cancer?
Sorry, I can't catch your.
So is it my fault that my child has cancer?
Please don't excuse yourself. It's not your fault. It's only a disease. I know that you love her so much, and you want on the best for her, and we also do on the best for her, and we also don't like her to get leukemia. Sarah.
Okay, so what are we expecting? Like, how's the treatment gonna go?
I hope that you should calm down, and maybe the day later we will ask about the treatment for her. Is this okay for you?
Okay, I don't want my child to know. I think she's too young to understand. I don't want her to know. Can you keep it from her?
Yes, it's a confidential.
Oh, okay. Do you mind explain that to my husband again? Because I don't really know how to explain it to him.
If you want, we can do it again with both of you, the mother and the father, for both of you to have this.
Okay, so I think I need time to think about this. It's just too much right now. So can we talk again later?
Yes, we know.
Okay. Okay. Thank you anyway.
Oh, I'd like to thank you, Mom Sarah. Absolutely fabulous job. Okay, and actually that's a very typical one. So let the panels go on and give comments. So who want to go first? Who want to give comments? And Phú. Okay, let's go.
Xin lỗi nghe bữa nay tại vô trễ chút, quý vị thông cảm, tại vì đàn ông bên này là nó đủ thứ chuyện hết đó. Sáng sớm phải đi chợ, giặt quần áo, đi đưa con đi học, vô bệnh viện thăm, đi lấy trứng, đủ thứ hết rồi, bây giờ mới được phép nói chuyện chút xíu ha. Thì xin lỗi bác sĩ Huỳnh, lúc nào cũng vô trễ là có lý do. Thùy Hình chắc chưa có gia đình thì chưa có thấu hiểu nổi khổ này đâu. Thì bây giờ cái vấn đề này á, cái topic nó rất là khó và rất là khô khan. Tôi có dạy học trò về cái topic nó gọi là breaking the bad news. Nghe rõ không? Nghe được không? Không nghe vậy trơn. Breaking the bad news.
Nghe được, anh cứ nói đi.
Breaking bad news thì nó có khi mà có hai phần, một bên đó là một bên là do người bệnh, một bên là do gia đình. Người bệnh đó nó có cái vân tắc gọi là DABA. Thì mình phải hiểu cái này trước là bệnh nhân nó gọi là deny, tức họ không nói cái này không phải tôi. Và cái thứ hai chữ A là chữ bắt đầu họ anger, họ rất là giận. Rồi cái thứ ba là bước thứ ba người ta tới nó gọi là bargain, có thể tôi làm cái này có thể được cái gì này nọ. Rồi cái thứ tư nó gọi là acceptance, họ bắt đầu họ mới bước đến cái chỗ là ok đồng ý là cái bệnh này có bệnh này, thì cái này 4 bước. Nhưng mà khi mà cái người mà nói chuyện với lại bệnh nhân nó rất là khó, cái này nó khó kinh khủng lắm khi mà breaking bad news, nhất là con nít nữa. Nó có 4 cái, nó có step gọi là spikes, S-P-I-K-E-S, tức là spike, tức là trước đó là phải quý vị phải setting nó rõ ràng. Ví dụ mình ngồi nói chuyện trên điện thoại như vậy là wrong rồi, rất wrong. Cái thứ hai mình hiểu bệnh nhân, họ hiểu cái bệnh của mình là cái gọi là cái perception. First là setting cái cần thing là perception. Rồi cái thứ ba là invitation, to ask the patient what do they know about the problem. You didn't ask, what the patient know. You let the patient rumbling along, control whole setting. Nó wrong. Cái thứ ba là cái mình phải giving cái knowledge, what you exactly know, what you're talking about, cái knowledge. Rồi cái thứ tư cuối cùng là mình phải cái strategy, phải làm cái plan cho mình, rồi cái summary gì đó. Cái nào bữa nào tôi có dịp tôi sẽ cho cái talk thì cái này very important. Cái này khi mình làm bệnh nhân, làm bác sĩ nó rất là khó, cái này khó nhất, là một trong cái khó nhất. Thì cái thứ nhất là khi mà thứ nhất là tôi nghĩ là cái xưng hô mà bệnh nhân là madam á, thì có thể nó hơi formal. Tôi không biết bên Mỹ, Việt Nam sao, chứ đây thường tôi gọi bằng tên. Rồi thường bệnh nhân gọi bác sĩ bằng tên, nó có thể thân mật hơn là gọi madam. Cái khi mình nói chuyện mình đã hiểu exactly mình cái topic mình nói cái gì. Leukemia trong cái đó nhất người ta muốn biết là tại sao mà có. Cái thứ hai là cái prognosis, là người ta lúc nào người ta cũng hỏi là cái này chance thì mình là trị bao nhiêu, rồi là có thể là tại sao. Thì nói chuyện cái này nó bệnh nhân nó hơi khó chịu. Thật sự bệnh nhân khó chịu cái kiểu này, mình để bệnh nhân khó chịu vậy mình không thể nào mình control được hết á. Thì phải có làm sao mình làm cái setting nó rõ ràng, có là SPI, S-P-I-K-E, S là SPI. Những cái bước này bắt buộc phải có, mình mới nói chuyện người ta mới control được. Thì nói chuyện tôi thấy hơi cái này nó khó, không dễ đâu, nhưng mà có thể có người bác sĩ như là bình tĩnh này cũng good rồi đó, hay đó. Có nhiều người bệnh nhân bác sĩ giận hay chửi hay gì đó, nhưng mà bệnh nhân này thì có những chúng ta cần phải học hỏi nhiều cái này. Mà cái này đa số những bác sĩ ra trường đó thật sự chưa có thể nào ai dám nói là có thể làm được cái đề tài này mà nó suôn sẻ đâu, rất là khó. Ngay cả khi mình đụng trận rồi mình mới thấy nó khó như thế nào. Nhưng mà cái này từ từ mình sẽ improve cái communication skill cái này hơn đó, vậy thôi.
Okay, just for the class, actually I posted online already the 6-step protocol for deliver bad news you see on the chat and also on your forum today. I also post the stages of loss and grief, included the 5 stages that Dr. Fudo, Wang Fu just mentioned: denial, anger, acceptance, and any of those cycles that can happen anytime. Okay, so move on. Any other comments? Because I think this is, you guys talk in interaction with all the instructor here. Anh Quyên, chị Như, anh Minh, any comments?
I just have a feedback here. The teams did very well, good job, worked very well, calm, okay, and explain carefully, okay. Honestly, that's good. That's the main point. But any grave diagnosis, you have to inject a little bit hope there. You see that a chance of treatment, okay? Because you say that, oh, the patient asked how can you treat it, and you said, oh, let it later. No, you have to say right away the chance and the percentage that are successful, and give them hope. Okay, you don't give her death penalty anyway. Okay, just give hope there.
It's a quick from it. Just a small thing. Instead of saying excuse yourself, just say don't blame yourself. It's a minor thing. The other thing is, with these bad news, the patients are very confused and they need guidance. So I think it's important to say that, it's very difficult news to deliver to you, but we have experience here at our center. We deal with many cases like this before. We have experienced doctor, we have experienced staff that can help you guide through this. And don't give them false hope to say that you're going to cure them 100%. Say that, it's a difficult condition, but we have experience and we have the support to help you guys through this. and tell them what the next steps is. And so sometimes it gives the patient, you know, a little sense of direction and less confusion. That's it.
Yes.
I think the most important key when you talk to the patient about this one, you have to do homework. You got to know the topic very well. You come in to get, you don't know the topic. You look very, idiot in front of the patient. You got to do all the homework, get all the lab results available in front of you, X-ray, all your CT, what a bone marrow the result in front. And when you talk to the patient, that's the one you convince the patient. All these tests we have done, and we have to go through and to get all your second opinion already to look at the result. So I know this topic is hard, and your child had leukemia, but there is some chance to cure, and we try our best to help you through. So somehow in the talk, it look like you have, the doctor has not known the subject very well. So that's why, big confusion of the patient. Patient have the chance to fight you in a way. They pass all the anger toward you. So next time before we do it, you have to know the subject before you talk about it. If you volunteer to do it, or you can't, you have to get someone else to do it rather than you come in, look like very incompetent in front of the patient. It's a very difficult topic, not easy at all. Usually we leave it for the senior to do the talk, not a junior.
Well, this is truly a very difficult topic, as Dr. Ho say. But in this exercise, we'd like to give you a taste, and we'll probably come back, okay? Because I think this is one of the very good topic that emphasize on medical speaking. So maybe in a couple of weeks, we'll devote one section about bad news, okay? So any other comments before we move on to the next GUA and Anman or Sarah?
Yeah, so I think that at first we should inform what is cancer mean, what is it do to your body, what if it's not treated, and then you will move on to not talk about the treatment so soon, but talk about a little bit about what the symptoms of the cancer and what the symptom of that patient will have that fit with the leukemia, and show on the result, okay, this and that, so that to prove that your kid have it, and then from there and talk about the treatment and the risk of the treatment, and use some sympathy words a lot in there, and maybe including some case manager or something that can help you because they will have a whole team in there. So maybe a social worker or something that can help also, like somebody else, not only doctor that can, or nurse in there to, is that right? So anybody can be in the same space, or at first ask, okay, you want to go talk in the room, or how you doing today? So at first give some comfort space first, and then what else? Yeah, I think that's all I want to say. And maybe we will leave you some information, get some paper, and for mom to read at when she go home, so that she have any question, you have phone number from you to call us back anytime, something like that. So she will feel more comfortable.
I'm sorry. I will post the PowerPoint, the lecture I'm giving to the student in a PowerPoint form through the your Dr. Win Tran for you, and you can see how that you need to go through those. And next time when you go back, I think got more confident in a way. You need to read that PowerPoint. I have taught medical students for the last 6 years about this topic. And even when I had the case 2-3 years ago with a terrible outcome, I feel, exactly like you. I sit in front of the patient. I'm just like so incompetent. It's so hard. It's so hard. It hit you terrible. And you have to know, I will post it. And if you got chance to go through, and probably next time we go back to revise it again.
Sure. I think we will at least revisit this topic one more time. because this, again, we focus on medical speaking. So this is the topic that we like to revisit. Okay, any feedback from the class? I like to for active participation from the class. Any comments? Nobody slept yet, right? All right. Good. Okay, let's move on to the next one.
Yes.
Okay, the next team would be yes. All right, so just to all the panelists, so the next team will talk about treatments and plan. So we keep going on a case of leukemia of Jessica, 8 years old, a daughter, and now those two doctors will talk about treatment plan after the diagnosis was confirmed and informed to the parents. Okay, and okay, so who would be the parents now? Queen, you want to try? You want to try to become Jessica's mom?
Okay, we can start. Okay.
All right, so here, Queen, it's Sarah, it's Jessica moms, and then you guys go ahead and explain about the treatment plan. Go ahead.
Hi, doctor.
Hello, Mr. Queen. I'm Dr. Ân. I'm pediatric oncologist. I'm your child's doctor. Yes. And I know the past days are really hard for you, and now we need to calm down to discuss treatment for her.
Okay. Please tell me what is the treatment going to involve?
The main treatment for leukemia is chemotherapy, and your child has standard risk acute lymphocytic leukemia. It's mild type of leukemia, and the main treatment for her is chemotherapy.
Okay. I heard that chemotherapy is very toxic. Why do you giving it to a baby?
Because it's a management disease, and so we have to use the drugs to kill leukemia cell in her body.
Is it gonna affect her brain function or her growth? What should I expect from this?
Actually, there are some side effects of treatment, and your child maybe grows slower than other child, other children, and he will experience many changes such as
the hair loss.
The hair loss, change color skin, and maybe he look like no no.
Look like aliens?
So, sorry, and
like people from other planets?
No, no.
No. Okay.
It just appear in first stage of treatment, and then after treatment, she if after successful treatment, she can grow up and can go to school. Then other children.
And what are the chances of curing the cancer with the chemo? Is it 100% that she's gonna be normal?
Sorry, I can't catch.
What are the chances that the chemotherapy is gonna cure the cancer? What is percentage of the people who recover from the cancer?
Yes, actually, this leukemia can be cured with a success rate of about 80%. Yes.
But I like that chance, but I don't like the side effects from the chemo. My grandmother told me about Eastern medication that can cure cancer. What do you guys think of that? Like herbal medication that can cure cancer without side effects. Like plant medication that can cure cancer without the chemo. My grandma said that it worked, so should I give that a try first?
Hột mãng cầu quá em.
Garlic or
the time for treatment is around 2 to 3 years. The treatment consists of 3 phases. The first is induction, the second is consolidation, and the last is maintenance. Do you follow me? And any question?
Yes. Should I go time out or should I go on or?
That's fine. I think just
okay.
Yes.
I think that's fine. I think that's pretty good. I don't know. I don't think I have anything else to add. Yeah.
All right. Comments from panelists?
Okay, I would like to jump the gun right now. Okay, when Dr. Khuyến asks you a question, and if you don't understand what he say, you have to ask again. You don't answer the question by another answer, but it's not relevant at all. Okay, because Dr. Khuyến asked about herbal, những cái thuốc nam, thuốc bắc gì đó thì trị hay không? And you jump right away to 3 years or 3 stage or something, okay? It's proof that you don't understand it. And if you don't understand it, you should ask them again. Okay.
I just have one question for you guys. How would you explain what is chemotherapy to a patient in lay terms so they can understand that? How would you explain that?
Therapy use the drug to cure leukemia cell.
How? All right, so something that I like the class to think about. We as a profession, we know, but explain to a patient, especially chemotherapy. At least in my experience, when I explain to my patient chemotherapy, it's still challenging. So we will come back to that. Okay, so I let the other panelists. But something I like you to think about it when you go home today, how to explain things like that, because that's very important. once you can explain in a very easy way to understand, then you can explain the side effect, and then everything else will come after that. Okay. Any other comments, Anh Minh or Phú?
Sorry. Let me get back to the screen. Just stupid screen just come out. I can't see them. Okay. Now, probably I think the doctor hasn't done enough. You haven't got enough information. So it's a little bit tricky when you talk to the patient when you don't know the subject well. If you don't know, you probably get, okay, I'll get some information. I get leaflet from there. I give you the information from the website. I'll print it out. I will send it to you. I'll let you know about all the more information about it. Other thing about when you treat the information, you got to tell the patient when the treatment with any medication, there are side effects. Just tell, because the mother want to know what's wrong, with medication. With any medication you give into the patient, you have to know how does it work and what the side effect of them, and how you treat the side effect. So those information is vital information when you go into talk to the patient, when you treat, especially with childhood leukemia. It's a terrible thing, it's tragic to the family, the mother. So you treat. We just say, if the mother asks any side effect, of course, any medication or side effect, this medication will target the cancer cell in the blood, but they can cause collateral damage, can cause side effect. But we'll talk about side effect. And we'll let you know how we deal with the side effect. If you're not sure, then okay, I will give you more information on the leaflet, on the handout, and on website. I think we're dealing, something, and I think the mother a little bit mean when they talk about alien. Sometimes the word hello. The alien. So that's why the word's a bit hard to understand. So a bit means, I think. But in general, that's the way how we deal with the patient here all the time. But I think you handle pressure well. But again, I agree with Anh Văn. If you don't understand, you have to ask. That's the same problem with all the Vietnamese. Even when I first started medicine, when I don't know, I don't know. I just say, I'm so afraid to ask back. Can you repeat the question again? I think I just imagine something and I talk to them in different way. They laugh at me. That's a common thing. And all same Vietnamese patient, they don't know anything. They just always said no. When you have any problem with your health, no, because they don't understand the question, and they just say no. So I think a good thing to ask back, can you please explain, or can you tell me, slowly so I can understand? Can you explain me the word what you're using? So same thing, it's hard, but you got to ask them back to do it. And I think I agree. And don't assume the question. That might be a little bit unprofessional.
All right. Thank you, and Phú. Any other comments from our panelists?
Yeah, just one little thing I need to leave a little bit soon. So, yeah, so I guess you still practicing, so you may get to, focus on your talk. Then you may not well aware that the patient may ask back, and just like and Phú just said, if you don't understand the questions, ask again. I know sometimes it feels a bit uncomfortable to keep ask again and again. Sometimes it's a little a trick. I don't know if this work all the time, but there's a trick that you just answer, like give a short version of the answer for the question you think the patient may ask, a short one, and say, is that what you mean to say? Is that what you mean to ask? So they may clarify the question for you instead of keep asking the patient to repeat the question over and over, and make especially the foreigner make them feel that you don't you don't understand English, and it may make your explanation. They may not trust you, trust your explanation, because they may not know that you know English well enough. Yeah, it's just a little trick to help them clarify the question for you by giving a short answer for what you believe, what they are asking you. But then they can clarify the answer for you. And yes, again, we are practicing right now. So if you have time to go back and look at your presentations, you will see that there's a lot. You can improve a lot in this one. And if you, especially cancer, if you're not confident in what you are saying, if you're not really give a good, easy to understand, if you don't make people feel confident to your knowledge, it will be very, very challenging. Especially the topic is about cancer. So keep practicing.
Sorry, I just give you another trick. When you don't understand what people say, you can say that, sorry, I can't catch the word. Okay? Could you spell it for me? Sometimes you look stupid, but you look stupid first time, and then you learn about it. Because some Vietnamese, they read the textbook very well, but when they hear the term, they couldn't match between the word and the sound. Okay, so sometimes you just say, oh, could you spell it for me? Okay, so that you learn from that. Okay, the second one about the chemotherapy, almost chemotherapy have common side effect. You should know. So and it's related a lot of the GI, especially with the children too. Nausea, vomiting, diarrhea, something like that. You have to go by heart. You have to know about that. Okay, because in your answer, seems that you don't know which one is the main side effect from the chemo. From now on, you should know about that. Thanks.
Quick ask to my comment. The last two doctors and the D2 doctors, we have one thing I might not be comfortable when you say tell the patient calm down. I think you might trigger the anger from them. So just say, might use something more political way. I know that you are very angry, or you're not, your child quite sick, but if you might, can you give me some time? Can I talk about this? Something. Just don't tell them calm down. Sometimes really get anger back from the patient and from the mother. No, calm down here, please.
Okay, thank you, Dr. Ho. One thing from my observation for you two and then the previous two doctors, when I confront with a problem like that, I usually start with, what is your understanding about your daughter, your son conditions? When you ask that, go back to the spike one, you invite or you ask about the perception about parents. That would be a better start than you say, I'm going to tell you the diagnosis. When we come to see patient with complex, no matter what, the first thing I say, could you tell me what is your understanding about your current conditions? So by asking that, you have some idea where they are, because maybe you're surprised. The patient knows something, the husband knows something, and then the daughter knows something, and then the three of them not on the same page. I'm sure you see this already, right? So as your job, come to the room and ask and see that. And that's just my tip. All right, so we have about 20 minutes left. And as I said, I try to limit it to 2 hours. I know you guys the panelists like to stay longer too. But I think for productivities and all the doctors really late right now. So who haven't talked at all, just raise your hands. Who have not said anything in today's class? See how many people. All right, so 4 people, right? So we will divide in 2 teams, right? So the next team will talk about the prognosis when the patient going downhill, and the last one, I think you will in this scenario, one of you said that the patient want to sue the doctor. You know, I'm not sure if we let's move it. That's really a hot topic. So why don't we do this? Why don't the patient Jessica is not doing well, and now you go on to explain to the very anxious mom Sarah what's going on, and the patient need to go back to the ED, and let's go from there. You have 10 minutes for a team of 2 people, and then I'd like you to explain and inform about the condition Jessica, why she's going downhill. Okay, who's the next one?
One more question.
All right, are you ready? Okay, who's your teammates? Okay, so let me go back. I'm Sarah. I'm Jessica's mom, and Jessica just been admitted in the emergency rooms. She have recurrent bleed. She have worsening joint pain. She have shortness of breath, and she continued to have vomiting, nausea, and she's not doing well. Go ahead.
Hi, mom.
Yes, doctor. What happened to Jessica? I don't know why after chemotherapy now she go back to the hospital. You told me that she could be better. You told me that the chemotherapy may somehow save her life. Well, what happened?
Yes, I just know that she's given to the ED room, emergency room, and I hope you can be calm down. I hope you more steadily, and I let me the time to explain you more about her situation. And after doing the chemotherapy, she has some abnormalities through the process. Yeah. And now we have to kind of try our best to have to make her out of the severe situation.
You think she's gonna die?
Okay, the doctors are trying their best to make her better, but we have many machines, the professional doctors and nurses, and we gather together to make her okay. So I hope you can be believe just on our team, just doctors. So we will have your daughter.
Okay. Who's the doctor next to you? Is she a student or somehow she just come to you and she didn't say anything?
Oh, she's a junior doctor.
Okay.
Let's say something.
Hello.
Hello. Okay.
I hope that you can calm down, and I think you may be difficult to accept this news. Your baby become tức là em phải không?
All right. So what's the next step? This is my only daughter, and You told me the chemotherapy did not. So right now she's okay. Are you going to keep her in the hospital? And right now Jessica did not know anything about her condition. How should I tell her what happened?
Okay, she is kept to be monitored by doctors and nurses in ICU, and you know, chemotherapy have some side effects that doctors explained to you before, and I know it's very hard, it's very tough for your youth and your families, but that, you know, the cancer is a fatal disease, and I know it's difficult to accept that, and so I think it's better for you and your family is that you should have a good and stable mental to
What?
be calm down.
You think I have mental problems?
I mean, you should have a stable emotion to control your emotion.
Let me ask you this, doctor. Do you have family?
Yes, definitely.
A daughter?
Yeah.
How old is your daughter?
She's 5.
Okay, she's 5 years old?
Yeah.
Does she have cancer?
Okay, I understand. I know how you are feeling.
You don't. Okay, your daughter is fine. My daughter had cancer.
I understand. What are you thinking? What are you struggle with? I know it's very tough. It's extremely tough. But I have to work with many babies have a cancer every day, every month. I know what the family and their parents thinking. But you must be calm down, must be steady, and I will with you. I will be with you to deal with this problem. Yes. And Jessica, she's in a bad situation now, and we are trying our best to help her with we are trained doctors and experienced nursing, and we will use machines, drugs, and try our best to help her. Okay.
All right. Thank you. Actually, let's time out right here because I think this is a lot of, and I forgot your name. Who's your next to you?
Her name is Thảo.
Okay, Thảo. I like you to talk more because, as I say, come to this class. If you don't talk, you should consider not coming to this class because everyone come to this class. You should either say something or participate actively. Okay, and okay. So I let the other panelists give you comment on this because this is very crucial that I like you to take home as one of your point today. I see Dr. Din already smile. I know he has a lot of things to say.
I don't. What I can say that is the same like Anh Phú say. Okay, number one, don't say calm down. Okay, because it's not related to. Okay, it just provoke the patient angry. Okay, and don't show that you are professional. You see many patients. Okay, that's not anything related to the patient. You just say something that the patient want to know. It's the condition of the baby, condition of the child, and how can we help her, help him, or something like that. Okay, so just concentrate on that. Okay, and don't say something outside. It's not good at all. Okay?
Dr. Ho?
I think can Win and I do the quick role play just 2 minutes to see how, the way how we're dealing it. Okay.
Sure.
Hi, Jessica. I'm Dr. Ho. I know that your daughter has been readmitted to ER room and she's not doing very well. I'm really sorry about that. So what can I help you today?
I'm not sure. I don't understand. You guys told me that she gave chemotherapy that can help her. And so now what happened?
I'm really sorry about that, but let me rephrase back to you this way. With medication, it's not 100% work. Unfortunately, in your case, Jessica has a little relapse problem. I know that your mother, you're really worried, but if we can help you, can I check your daughter first, and I'll let you know exactly what's wrong with her, and we can help you, and we can work together, and we can help the Jessica. I know this is a disease, a terrible disease. If I have a daughter, if my daughter has the same problem, I might have the same feeling, exactly the same feeling with you. But you can help me and I can help you and we can solve the problem. And, we can work to make sure Jessica is fine. So let me, give me some time at work and I'll come back to you and let you know exactly what's wrong with her and what the plan, what we're going to do. Shall we do it? Okay.
Thank you. Thank you. Okay, so you guys see that that's a typical and that the typical response because and I tend not to tell my resident, my student, try not to say I know how you feel, because this is a very wrong way to say in medicine. Like you will never be our patients, no matter what. Like we said, oh, to me or anyone, if you know enough, we cannot know all the people feeling, right? So like Dr. Fu said, they calm down and explain to the mom. So that's one thing I like entire class take home today. When you talking to a cancer patient or with parents, don't say calm down, because you know this, right? Everyone, you say calm down, they think that you think that they're not calm, or even worse, they think they have mental problems. And like I try to play the role, but if you say someone have mental issue, that's a big thing, that big no. And now you're not dealing one patient, you're dealing two patients, the other one with a new diagnosis called mental disorder, and why you try to figure out with the first one with cancer. All right, actually I'd like to see Queen, do you have any comment on that? Because I know sometimes you have difficult patient too, and how would you recommend?
Yeah, for me, I totally understand that. I usually say that I don't say I know how you feel, but I say I understand your concern. I understand why you feel that way. And then my goal for these difficult patients is always to say that, I know you upset and anger, but let's, pull back and because we have the same goal, let's work together. Our goal is to make Jessica or the patient better. So we have this, just explain to them that you also, it's also in your interest to make the patient better. And you have your best interest in making the patient better. So they feel like you're on the same team with them. I think that's how I usually approach the difficult patient.
Thank you, Queen. How about you, Jin? As you practice in pediatrics, I'm sure you see cases like that too.
Yeah, I think that they have some word that use a little bit strong, as a use bad or use fatal disease. Does not seem to be appropriate in this situation. Make will be maybe escalating the worries of the mom. So try to calm it down, doing something different, or use trust instead of you believe. Use the word believe. Or you need to introduce yourself, or get shaking hands also with the patient to make sure that you make a good relationship at first and make they know who you are, what position you are in the hospital or in the case of the patient. Then you start talking about the kid, or after you explain and you say that what you think the kid has, what any plan that you have to do. Okay, we need to put the kid under IV fluid, or getting some pain medication for the kid, or get some blood tests. You might need to do certain initial plan, and then after that, I will come back with you and get a more detailed plan for you, and ask him to have any questions at that time. Yeah. And then I agree that I will use something like understand you as a parent or something like that. I will do that. That's it.
Thank you. Yeah, thank you. Dr. Ho.
When you say sorry to patient, doesn't mean you accept, your faults. And sorry is nothing, but sorry is say a lot of time. I say sorry to my patient all the time. I'm sorry, but doesn't mean that I accept my guilt. There's nothing wrong with it. So please, I'm not sure in Vietnam you say xin lỗi all the time, but I'm just say sorry to patient. That sorry means just nothing, just sorry. It's sorry, just sorry. Calm the situation down. I'm sorry, your daughter. I'm sorry, I hear that. That's normal thing to say, everyone.
All right. So let's move on to the last team. Who is the last to haven't talked at all? Now we saved the best for last. This is the most difficult one. Okay, are you ready? In this one, I like you to pick a panels here because Jessica, she passed away. Okay, and now you have to inform the parents that she will not survive. She did not survive. All right, it's your choice. You can pick any of us, become Jessica mom. Who would you pick? Who? Dr. Fu? Okay, wow, this is the perfect combo. That's the best for last. All right, Dr. Fu, at your leisure.
Hello, I'm Dr. Thuy. I'm responsible for the treatment of your baby, and this is Dr. And she works in the care unit with me too. And
Doctor, I'm not saying anything. What happened to my daughter? Why she passed away? What have you done to my daughter?
You calm down, please. Calm down, please.
I'm not calm down. I'm very calm now. I just want to know exactly what's wrong with my daughter. Why she passed away?
Are you Jessica mother?
I'm not calm. Just what? Tell me exactly. You the doctor. You tell me what's wrong with. Why? I'm going to sue you.
I know. We know your feeling now, and I tell you that your daughter has a symptom. The symptom of blood problem. You know about that.
I do know what's wrong with her. You've been treating her for so long. She's suffering a lot with the side effect medication. Now you couldn't do it. Why can't you tell me before?
Yeah, I see. We tell you that, and we tell you now.
Yes, but I want to talk to her family to about her condition, and where is Jessica's father?
No, I'm her mother. You can talk to me. I'm talk in front of you. Just I'd like to know why she passed away, and what have you done to her?
Yes, and now I will talking only with you. Do you know your baby disease?
Yeah, I do know. I know more because it's been suffering for years, a few years now. My daughter, I searched Google. I know most of the things, but why just, the doctor said this can be cured. But why, what happened now?
Yes, as you know, your daughter has acute leukemia, and now her condition gets worse. Her situation is very severe. So she is in ICU, and we are her doctor, and now we maintain her life by endocrine.
No. I didn't know that. I've been told that my daughter had passed away. You don't know anything about my daughter. What are you talking? What are you talking about? The doctor told me that my daughter has passed away. I got a phone call from hospital. Now you told me my daughter is in ICU.
your her disease is very severe, and so he, I guess, was with her complication, and now he's she in PICU, and
No. She has gone, doctor. She passed away. She died. Don't you know that? She did. She did. She gone. She gone.
Yes, I think because before we treat your baby, we talk about her and some complication. She can affect this, and have about 20% patient leukemia can die. I'm sorry to say that, but we try our best.
I do know that you try your best, but it seems like you don't know about what's wrong with my daughter. So I'm going to call the lawyer. I'm going to sue you and the hospital.
We tell you before that 80% that the treatment will be success, but it's maybe 20%. Here it will be failed. I told you before. You don't remember? You didn't remember?
Yeah, I do remember. I know that not all the treatment are perfect, but I seem like you, a doctor, treating my daughter, but you don't know what's wrong with my daughter and what my daughter's situation. It seems like you, who I'm talking to you to. That's not no wonder why my daughter passed away. I think that's probably I'll let my lawyer to talk to you.
Oh, okay. I know your feeling, and I know you hurt very much. But I think you don't remember what I said before. So I say that.
Okay, all right. I don't remember. You accuse me. I don't remember. Fine. I know. I'm sure. Okay. I'll let my lawyer to talk to you about what my memory. But I'll see you in court, and I'll take both of you and the hospital to to court to sue you for for incompetent.
I understand what you feel now, but I haven't even talked to you about her disease and her plan treatment and procedure, but your daughter was and she cannot live with me with us. You you have to calm down and I want to share
all right, time out, class. I think that's a good one, and I'll let Dr. Ho take a moment here and see other panelists' comments. But as I say, one thing from this class, one point: please do not say to the patient, "Calm down." Okay, I hope that you remember that. So don't say that. And then, Queen, anything?
Okay. I would like to say first, never make the confrontation to the patient. Okay, never ask them that. Do you remember? You just put the fire into. It's not good at all. Okay, the patient maybe not remember everything, but don't repeat it again. Do you remember? I told you. Okay, That's very bad words that you say to the patient. Okay, you try to go with them, not confront them. Okay, so you say very easy, very simple. You should say that your daughter's condition is very, very grave. Okay, we try our best, but she can't make it. That's it. Very okay. And then you go so say don't explain blah blah blah. Here this the statistic is 80% something, and it's nonsense to the patient. Okay, they couldn't hear from that. Okay.
All right, Queen.
I think I think it's a very difficult situation. I think even now I still have a hard time with when a patient die. But I feel like for the like the prior doctor said that you usually said that I did my best to our ability, but unfortunately, sometimes medicine has its limitation, and you just do that. And then the other thing is not about talking to the patient, but in general, if if you update the patient, keep a communication line with the patient, the family throughout the time, because people don't die like in an hour or two. So you update them, say, oh, now the conditions getting worse. So it's easier for them when you tell them, okay, now they don't make it. So at least they have a step of knowing, the patient condition getting worse. So it's easier to accept rather than go from, patient came to ED and now you call them and say the patient died without nothing in between communication wise. But I think it's a still very difficult situation to to deal with.
Right. Thank you, Queen. And any other comment, Chị Như and Sarah?
So yeah, I agree that it's very difficult for this. I never really done myself, only for my lectures. But normally, I think that when I hear that, I think it's still a little bit extreme word, a little strong word that you try some think about some replacement of the word to be lighter. And I like the word like unfortunately, something like that. So it looked like lighter for that. And you can also say really you right now, or if you can want to be with your child, we can help with that, thing like that. So anything I can help with, please help me. So and then make eye contact very well, very calm, slow, don't do quick. Yeah, imagine that you are the one that really feeling the loss, and you might do better with that. That hurt.
All right. And Paul?
I think the way we see the patient right in probably in America or in other world is quite challenging. So the patient got patient chart up right. So that the way that they got something, doctor has to provide. So again, just always don't confront with patient. I know that they wrong, but no point to fight with them. Go with them, smooth them out. That's a technique. That's a technique of the communication skill. A lot of people lacking it. Even us now, I think Queen said it's still difficult. It's not easy. So all the hospital had the open disclosure procedure. We can go through there. If you have a problem, yes, okay. I know that you're having problem. I get some expert or my other doctor who involved in treatment with your daughter case will come here to explain to you what's wrong with the patient. And also, if you want more information, I know you can get the legal advice. But yes, you can. I'm happy for you to go through. Don't fight with them. If you want to go to lawyer sue, that's fine. Let them do it. And I get my my legal team from for my manager hospital will come down to talk to you, and we can, if you like to go the other way, yes, we have the right to do so. But at the moment I concentrate on just Jessica had passed away, your family in tragic situation. At the moment it can help you and get other team to come in to help you, and after that we can sit down together to talk about why it's happened. I can go through all case. I get all the doctor, all information available. Or if you want a legal lawyer with you, I'm very happy for you to go through. At the moment, can you get some time to sort this problem, and we can have a big meeting together and go open disclosure. You can have many questions you like, your family to come in to talk. Invite everyone. Just the other thing, don't invite. I don't want to talk to you. I want to talk to your husband. Oh, that's that. Oh, she would. That's not. It's not. I wouldn't do it. It's terrible. That's a terrible thing. Okay, and don't come down and don't challenge them. I told you before. Oh, that's it. That's it. You gone. You gone. Terrible. You're terrible. You put a lot of fire. The fuel in the fire. So it's hard. But take years to do this. I'm still not sure we're still doing right. So in Vietnam, probably it's made a different way. Okay, but again, I'm sorry. I'm sorry. If can you let me talk? Or if you want to say it, don't calm down. No, calm down, please. Okay. Very good. So we get there. We get there. I'm difficult patient. I'm difficult mother, but it's good.
All right, thank you very much, Dr. Ho, and thank you all the panelists. I think we finished all that today, but the take-home point simple from today's lecture. Do not confront with your patients, and do not say calm down. I repeat again, I don't want in the next 6 weeks if somebody anxious and you say calm down. And you know the reason why. Usually this is the time the class is ended. Queen, this is your first time here, but I like to stay a little bit with this class. Just want to see how we do in terms of 6 weeks. Usually this is the half time that we sit down, evaluate. And I like you to talk to me in English. Now, this is a time for you to tell us your common suggestion, because obviously if we're not doing well, we have to find, oh, this is too complex for you guys. We can even lower, we can go very basics. But it sounds like some of you can keep up with this pace and some of you don't. So I like to hear from your feedback. And I would be appreciated that if the rest of panelists, you can stay with me a little bit. I know it's late and everywhere, but I really want to put our effort into a result that come out. All right, go ahead, class.
You say first about the comment about the class.
Yeah, and what would you like to do in the future, in the next week?
Exactly. So my question, what should we do in the next 6 weeks? Because it sounds like today and the past several weeks, and you guys most of the time, I noticed that some of you talk a lot, but some of you don't talk, very few. And so let's set a goal for the next 6 weeks so we can adjust the class or we make it better for you guys. Because for example, today, obviously it's very challenging, and I can reassure you, we'll come back, okay? We'll come back to this topic at least one time, how to deliver bad news. So everyone will present feel more comfortable and don't say, calm down, okay? So how about next one? And I'd like to hear from panelists too, Anh Ho, Chị Như, and Sarah, because you guys have been with the class almost from the beginning, especially Anh Dinh. And then Dinh right now teaching nurses. So you know what, this week I'm so busy, I was not able to, but I'm sure he did really well. I mean, I look at his video, it's way much better organized than us. Think about it. Okay, you guys, I like to challenge the entire class here. You guys are not as organized as the nursing class. So I challenge you guys, set smaller goal, okay? We don't have to be really good, but focus smaller goal.
Because we prepare another topic and so another seminar. I have surprise, but I study more and more new example. Don't talk, calm down, and I want to continue study the same topic.
She want you to tell about the class in 6 weeks and what will you do in 6 weeks later.
All right.
Okay. Sorry.
Yes, go ahead.
Okay. While you're thinking about which one that make your class much better, I just have the perception that seems that the model of teamwork doesn't work. Because when you have a team, you have 2 people there, looks like that just only one talk and the other one just stay and sometimes thinking away. Okay. So I like next time one by one, but you have to concentrate what you have to prepare. Like Anh Phú say, you have the template that you ready, and when you get in, you just run, okay, and fast. Don't think, don't crash your head, don't turn your head around to see what happened, okay? You just, when you open, you just like, you shoot, okay? You shoot quickly. Which one? Which is your template, okay? Okay, so I would like that just one by one, not teamwork. Teamwork doesn't work to me. Okay.
We want to one by one to first. I afraid we have not enough time to talk on the people here.
That's why you have to make faster, okay? Because everybody say that about 10-15 minutes, so it's and you have that time, yeah? It's just a pause, too much pause, and you think, okay, that's a problem.
So I think that in order to do that, maybe you need to be more proactive, like really, okay, I want to do this today. I want to talk about this. Otherwise, if anh Nguyên make up a scenario, maybe she didn't prepare for that. Maybe she get into nervousness easier. So maybe you just say that, okay, today I want to talk about this. And then you start the topic, you start something that you can tell say some word, some sentences about the topic you want, and then you start into the real conversation you want. Maybe that may be better preparation.
Oh, the topic about this had been posted online about a week ago, and with 7 team, with 2 people. But I agree. I think individually would be a better approach. But here the issue, timing wise, I mean, I'm glad that we have so many instructors today. In the future, what I like to have actually 2 or 3 instructors per class. Not only the feedback time reduce, but also we can alternate. I mean, there was a time that, I mean, only me and Dean, and we desperately need doctors, instructor. But today we're lucky we have 1, 2, 3, 4, 5, 6 of you guys. So I think I should do a better job in terms of, I mean, if you like this one, you can commit, just tell me you can come 1 per month or even 1 3 months or whatever, but I can put into that so that so Andin doesn't have to be here, or me, or Min, because right now 3 of us we have to cover how many classes, and there's so many, and I know it's exhausted because it's really 2 or 3 hours, and I'm amazing how you are, Andin, my head up, and also Min too, and I know and full whole you guys try, you very dedicated to this class, and I liked spend a lot of time with you guys with just Anpu, actually 1 day, because he has so much to teach you guys. So that's how I like to set up the class. Just 1 day or just 1 or 2 instructors, and you go like really go to the level of detail that and who would like to teach you, or Indin or Chị Nhi, right? So that's the future is we like to assign instructor 1 or 2 or max 3, and then hopefully you have more time to interact. But also individual wise, you come and be more proactive. Like just come up here and say, hey, I like to talk about this. This is my topic. Okay, it's easier. Even though I'll tell you this, if you go to a real life scenario, it's not like that. Never. No patient read medical textbook before they go to the hospital. Nobody come to the medical room, medical emergency with a textbook. Hey, I have meningitis. You see meningitis in my head, or acne in this side. Okay, or I have gonorrhea in my groin. People don't say that. You, as a doctor, have to tell people or have to investigate problems. Does it make sense? So let's do that. I'll make sure that I will try to schedule a group of instructors so I can utilize. This is one of the best resources because we have people from Australia, we have people from Hungary, cardiology, pediatric, OBGYN. You see, this is a really good team instructor, and I like you. This class take full advantage. I said full advantage every single second. Okay, chị Thí. You know what, guys? Why don't you speak Vietnamese? Okay, that's fine. Just go ahead, tell me in Vietnamese.
That's better.
Ok, mọi người có thể nói tiếng Việt được, không có sao hết á. Ok, bây giờ qua giờ học rồi. Ok, để tôi nhắc cho các bạn nhớ, các bạn chỉ còn có 6 tuần nữa thôi. Vậy chúng ta còn 6 lần nữa thôi.
Nhưng mà mình xin nói thêm như thế này nha, là bắt đầu so sánh từ cái ngày đầu cho tới ngày hôm nay là các em có dạng hơn và nói chuyện khá hơn á, chứ không phải là tệ hơn đâu ha. Đừng có sợ vậy á. Có khá hơn nhưng mà chúng tôi muốn mấy em khá hơn nữa và nhanh hơn nữa.
Anh Đinh nói rất chính xác, tại vì mình không có nói cái điểm mạnh của các bạn này. Các bạn bây giờ, lúc trước các bạn lên chỉ cười thôi, bây giờ các bạn cười thêm, nói thêm câu nữa là hello. Ok, đỡ hơn xưa rồi. Hồi xưa này lên cười cái rồi đi về, bây giờ lên xe cười cái hello rồi vẫn đi về. Ok, hy vọng là tới tuần thứ 12 là các bạn lên nói thêm chữ là goodbye. Ok, dễ hơn.
Please let me talk first.
Okay, go ahead.
Nói tiếng Việt mà nói đi.
It is okay me.
Whatever you feel comfortable, okay?
Yeah. First, I want to say thank you all, and I feel that I'm more confident and more comfortable to talk with you all, and I think this class it helped us a lot. Our English better, and but I think it's a soft skill to talk and to play with the patient and the family of patient. We just me and I don't know I think it's a little bad. It's not good. Soft skill.
Okay.
Yeah.
All right. Other comments from panelists and Phú and hay là Sarah, anything that to improve the effectiveness of this class?
I have I think like they are you guys are very like much more comfortable talking with us now compared to the first week that I've been here, but like I think that if you guys can practice a little bit about like some basic questions that you will have to ask anyways, like how you feeling, what is your symptom, how's the pain, so like practice those questions like as much as you can, so it will come out naturally, so you don't have to think and translate that questions anymore. So get a few basic questions down and remember them. Make sure that you know when to ask what questions. So just the basic own card, you guys have to get that like down solid now before you guys can move on to the next level of like communication technique and everything else. So because like I still feel like some of you still have to like sit and they think about what you will ask and then what the question gonna sound like, what should I like put those, like what words should I use. So it take a long pause before you can get a questions out. So just have some sample questions now like written down in practice before you came to the class. Yeah, that's my idea.
Yeah, I think I agree that just keep practicing. If you make it wrong, you practice again. If you make it wrong, you remember about your wrong sentences, and you make sure you change it in your mind, make it a new sentences that you remember. I do this all the time, even in here. And I think that you do very good that at this certain level, we know that Vietnam, we don't have any chance, a lot of chance to talk. So that's why we can make sentences, but it's really hard to understand and talk out. So I don't think that any of you do bad at all. Very good. At that certain level that you just need more practicing, more chance to practice. And by that, it will be better. So just try the best, but try to find in dictionary or in Google and anything that you can find a good pronunciation. It's really important. Because of that, you can make the other people understand you and you can understand them. Listen to conversation or any movies that you make you getting better, because I know that Vietnamese is really hard, affecting the way we talk in here also. So we just need to listen a lot and practicing a lot to make it better sound.
Right, and Dr. Ho, do you have any comments?
Okay. Compared to the class in, the medical student class and this class, I think I'm not sure what the specialty these doctors are. Win, what specialty are they?
Pediatrics.
They're pediatrician. So we concentrate on pediatrics only. Okay, right. Okay. I think the communication this is a good chance for everyone to learn how to talk, to speak. Again, I'm agree with you that you can write, you can read, but communication is still the lacking. Be confident. Then also you need to do homework before you come to talk to the class, because the class is so short. You got only a few minutes to talk to us, and most of the time I think we spend too much time in the panel, criticize, or try to do constructive, criticism, and sometimes take too long and you don't have chance to talk. But you have to be more proactive. You talk, don't let us talk too much, and learn, try to do, if when the case been assigned to you, you have to practice at home before you come in. I sound like we are all busy. You are busy, I'm busy, everyone here busy. I run, I got 3 children, you got children, everyone busy. But if you have put effort into it, you go to the class, you have prepared a case, you have to stand in front of the mirror, you imagine the question that the panel will ask you, and you do it practicing way before you come into this talk, and you gain a lot, you learn a lot, you talk a lot, you're more confident, you don't feel shy, and also because you have been a doctor, sometimes you feel a little bit funny, you're sitting in front of this guy, tell you what to do. I think a little bit touchy in this way. When you talk to medical students, it's easier. So just take us, at the constructive, like positive, constructive, like criticism. Learn from this, go home to see why I'm so many pauses between my talk and why I didn't understand the question. I think majority because you were not prepared when you go in the class. It's hard. Communication is one of vital important. If you want to practice in Western world, it's vital important. And many people have been sued because miscommunication. I think it's get there, we get more, but I'm sorry, whatever in the field, you practice, you don't practice, you never get better.
Ok, để cho mình nói một tiếng Việt một chút xíu để mấy em rõ hơn nha. Ok, everybody here ha, theo mấy em là phải practice. Nhưng mà nhiều khi á, mấy em nói sai mà không có ai sửa. Cái đó là rất quan trọng. Do tôi xem mấy cái video clip của mấy em á, cái cách hành văn hoặc cách sử dụng từ và câu cú á, nhiều khi tôi cũng vậy thôi. Hồi tôi mới qua Canada cũng vậy, nhiều khi mình nói giống như trong sách vậy đó nha. Nhưng mà nhờ có những cô worker họ nói mày nói gì không trúng, mày mà hãy nói như thế này nè, đó, thí dụ như thế. Do đó phải có người sửa mấy em, tại vì mấy em nói ha, nhiều khi chúng tôi không hiểu, nhưng mà trong cái cái session của mình ngắn, hay là mình không có chạy vô đó, nhưng mà đúng là tôi có nhiều thì giờ tôi sẽ xem mấy cái video của mấy em và tôi sửa từng người một. Và đã có trong quá khứ rồi ha, những người nào nói dở quá tôi bắt học với tôi một cái ngày riêng để mà tập mấy cái phát âm lại cho nó trúng. Và những cái câu cú của mình xài rất là buồn cười, nói lên người ta có thể hiểu, nhưng mà người ta không nói như vậy. Do đó mấy em sẽ xem lại mấy cái phê bình của tôi trong trong Facebook á, những em đó phải sửa lại những cái câu cú, phải có người nghe và sửa lại cho mấy em thì mấy em mới nói trúng. Chứ nhiều khi mấy em nói hoài, mấy em tưởng trúng nhưng mà không phải trúng.
Ok, đây là những cái góp ý rất là chân tình của mọi người. Hy vọng là các bạn suy nghĩ về những cái đó. Thì quan điểm của tôi là chúng tôi ở đây giúp đỡ các bạn, và hy vọng là các bạn cũng cố gắng. Thật sự so với 6 tuần đầu cho tới bây giờ thì các bạn cũng đã tiến bộ khá là nhiều rồi. Như vậy nhằm tuần sau chúng ta sẽ làm gì, và những tuần kế tiếp chúng ta sẽ làm gì? Bây giờ tôi đề nghị như thế này. Tuần sau chúng ta sẽ nói về how to deliver bad news. Tại vì cái này là cái mà các bạn còn đang nhớ ngày hôm nay, và các bạn đang lăn tăn, lung tung, mơ mộng, hoặc là cái từ nào các bạn nghĩ ra. Thì tuần sau chúng ta sẽ làm cái đó. Nhưng mà tôi muốn là trên cái group của chúng ta sẽ assign rất là rõ ràng. Tôi muốn các bạn tự chọn chủ đề là tôi sẽ nói về deliver bad news của cái gì. Ví dụ về ung thư, hoặc là về cái gì đó. Bad news nó không chỉ đơn giản là ung thư, nó có nhiều lý do. Ví dụ như là một cái tai biến, hoặc là một cái biến chứng sau hậu phẫu, hoặc là đứa bé có vấn đề gì đó sau cái chữa trị. Bất kỳ cái bad news nào, và các bạn dùng cái format, cái mẫu mà Spike tôi đã đưa trên cái group rồi, và làm giống như một cái bài tập như vậy. Chúng ta sẽ bắt đầu từ cái đó, và hy vọng là các bạn, về cái quan trọng hơn là tôi không biết là lớp các bạn sau khi xong này các bạn có ngồi đó uống cà phê không, hay là mấy bạn về nhà? Hả? Có uống cà phê hả? Ok. Tôi đề nghị như thế này, nếu như các bạn ở đó ăn trưa uống cà phê, tại sao các bạn không thử nói chuyện bằng tiếng Anh đi? Tôi đồng ý với anh Đinh là nhiều khi chúng ta nói tiếng Anh nếu mà không có người sửa thì nó dễ sai. Nhưng mà trong một số trường hợp tập thành cái thói quen nó dễ hơn. Ví dụ như bắt buộc mỗi người tới lớp này vào buổi sáng chỉ bắt buộc phải nói chuyện tiếng Anh thôi. Ví dụ hi, how are you? Những cái rất là cơ bản như vậy để tạo một cái thói quen, một cái phản xạ. Như gặp hoặc là với bạn nói về cái oh I like your dress đó, ví dụ vậy phải không? Hoặc là I don't like your dress, it look ugly. Okay, so bạn sẽ nói là no, this is so whatever topic, it's something that mà nó liên quan tới các bạn, mà các bạn nói. Ví dụ okay, this coffee sucks, you know, like Dr. Thúy, she doesn't know how to make coffee, something like that. Các bạn có thể chọn bất kỳ cái chủ đề nào, nhưng mà nó liên quan tí xíu và nó thú vị hơn. Thì cái đó tôi đề nghị là như vậy. Tại vì chỉ 2 tiếng, và thậm chí bây giờ 2 tiếng rưỡi ở đây nó chắc chắn nó không đủ, và tôi biết nó sẽ không bao giờ đủ. Và chúng tôi sẽ cố gắng trong khả năng của mình để giúp đỡ các bạn. Nhưng mà tôi muốn là các bạn phải nghĩ tập nói tiếng Anh, tập bên ngoài cái lớp này nữa. Và tôi nghĩ như vậy thì chúng ta mới có thể tận dụng được. Tại vì khi các bạn nói nhiều rồi, có thể nói sai cũng được, nhưng mà vào lớp này nói những từ đó sai, chúng ta sẽ sửa liền. Như anh Đinh mỗi lần thấy ai nói sai là anh sẽ ngưng liền, anh sẽ chỉnh ngay tại thời điểm đó. Ok.
Anh Nguyên thì em nói anh Nguyên.
Ok rồi.
Em có thể nói tiếng Việt, tức là
được.
Khi mà mình tương tác với nhau trong một cái vở kịch, khi mình đang diễn thế này, nhưng mà ví dụ như em có thể có một cái câu hoặc cái gì đó em không nói được, em có thể nói tiếng Việt và em nhờ anh dịch cái câu đó để mình nói. Vì cái thời gian mà mình mất đi do cái thời gian mà mình nghĩ cái câu nó không được, mình lúng túng, thì khi đó xin anh trở thành một thầy giáo và tụi em sẽ nói tiếng Việt câu đó.
Absolutely, cái đó không sao, cái đó rất là bình thường. Giống như là mình pause, ok, mình nói ok, người miền Nam gọi là xin tì, không biết người miền Bắc là như thế nào, người miền Trung không biết, nhưng mà Việt Nam nó hay chơi cái trò mà đang đánh lộn với nhau mà xin tì chút xíu, nhưng mà cái đó là mình ngưng lại và mình hỏi. Cái đó nó đỡ hơn là mình hai bên nhìn nhau mà không biết nói gì hết.
Dạ đúng rồi,
nhưng mà như thế này nè, như thế này tôi muốn nói như thế này nhá, là mấy em mà tập cái thói quen mà anh Việt là chết rất là slow, không phải tập tới cách mà nghĩ và nói bằng tiếng Anh luôn, tiếng Việt, chứ mà trong đầu mình cứ nhảy qua nhảy lại hai thứ đó là chết. Cái thói quen đó là không tốt đâu. Lúc đầu thì chúng tôi chấp nhận nha, thí dụ mấy em mắc bú quá, cái chữ đó mình nghĩ không ra cái cách nào, được quyền hỏi ha. Nhưng mà sau đó đừng có tập cái thói quen dịch qua dịch lại là không được.
I think that probably nếu mà cứ kẹt cái đó thì hỏi just say I'm not sure, I got this little one, they speak in English but I'm not sure if you can help me. Yeah, don't switch between Vietnamese and English. It make sound terrible. Oh, I'm sorry, I got the question. Can you help me with I can rephrase the question. It's easy that way, and it work better that way. And nhưng mà nếu mà nói tiếng Việt nhiều quá thì nói giọng Trung thì chắc không ai hiểu.
That's a good point. I'm just kidding. Okay, ở đây mình không phân biệt chủng tộc, mình là người Việt Nam. Okay, nhưng mà I like that idea. So if you guys, nếu mà mọi người đang trong cái buổi nói chuyện mà không hiểu gì, just raise your hand. Nhưng mà nói giống như anh Phú nói vậy, hỏi là hey, you help me, I don't understand this. And một trong những cái điều mà tôi muốn nói các bạn là tập nói chậm lại. Các bạn đa số nói chậm nhưng mà có một số bạn nói vẫn còn hơi nhanh. Khi mà chúng ta không bình tĩnh á, mà các bạn nói nhanh á là tôi biết liền à. Mà không bình tĩnh mà cộng với nói nhanh á là chỉ có trời mới hiểu được các bạn nói gì. Ok, tôi nhắc lại cái một lần nữa, cái đó quan trọng lắm. Trời hiểu, bệnh nhân không có hiểu và tôi cũng không hiểu. Thành ra đừng có làm như vậy. Cái quan trọng nhất là khi mà chúng ta nói tiếng Anh, cố gắng nói, thậm chí nói tiếng Việt, chúng ta, thì tôi không có góp ý đây, nhưng mà trong tiếng Anh, đặc biệt là trong y khoa, chúng ta cố gắng nói chậm lại. Ok, bây giờ như vậy thì có cái đề tài của tuần sau rồi và có cái assignment như vậy. Như vậy thì các bạn có ý kiến gì nữa không?
Tôi sẽ gửi cái PowerPoint, cái lecture about delivering bad news. Cố gắng đọc qua cái đó cho tuần tới ha.
Ok. Rồi, mọi người có ý kiến gì nữa không?
Tới giờ trưa rồi, đi ăn đi. Đi ăn. Mấy ông ăn ta ăn mới chừng.
Ok, mình đề nghị các bạn không phân biệt vùng miền ở đây nha. Ở đây có mấy người miền Nam là nói miền Trung mình không hiểu đâu. Ok,
để tôi kể câu chuyện, về người Trung. Bà xã tôi lần đầu tiên dẫn bà xã về Trung, về Sài Gòn. Tôi có bà cô, bà lớn tuổi lắm, bà là người gọi là đứng trong đọc là bà number one. Bà kêu bà xã tôi, bà dọn cơm tới nhà bà xã tôi, bà biểu tới về mời tới nhà ăn. Bà hỏi chứ mi ăn đi mi. Mà bà xã tôi bà đi qua đây lúc 6 tuổi, không hiểu mẹ gì, bà nói dạ, nhưng mà thấy bà sợ quá không dám ăn. Hỏi mi chê đồ ăn ta hả mi? Nói dạ. Rồi cái hỏi mi thiệt mi không ăn phải không mi? Dạ. Hỏi câu nữa, mi thiệt mi chê đồ ăn thì nhà ta dơ, nhà ta nghèo mi không ăn hả? Dạ. Xong luôn, thúi hết. Bởi cái giọng người Trung nhiều khi họ nói mình không hiểu nhưng mà rất là dễ thương, đúng không?
Ok. Cá nhân của mình chưa bao giờ, hình như là có lần mình ghé qua Đà Nẵng rồi, mà lúc đó Đà Nẵng chưa có phát triển như bây giờ. Năm 2002 thì phải 10 mấy năm rồi, nhưng mà nếu mà có dịp về Việt Nam nhất định sẽ ghé qua cái group này. Thật sự thông qua VietMD, mình có những người bạn toàn cầu như là anh Phú nè, anh Điên. Thật sự mình cũng chưa bao giờ tới Australia nữa, rất là mong có cơ hội qua đó, hoặc là gặp chị Như ở ngoài đời. Khuyên thì gặp rồi, nhưng mà thật sự là ngoài cái lớp này ra, các bạn cũng hiểu là mình còn có cái networking ở đây nữa. Mình nói luôn là sau 6 tuần các bạn vẫn có thể liên lạc, vẫn hỏi, nếu mà chúng ta cần vẫn có thể tham dự, nói chuyện được. Tại vì hy vọng là các bạn cũng có những cái điểm chia sẻ như vậy thì chúng ta học được. Và cá nhân của mình là rất là hân hạnh nếu mà có dịp quay lại Đà Nẵng gặp trong cái group này. Lúc đó chúng ta sẽ nói thử tiếng Anh nha.
Bỏ lại con tim ở Đà Nẵng là chết cho á.
Cái đó nguy hiểm lắm mà anh Phú. Ok, như vậy thì mọi người có ý kiến gì nữa không trước khi chúng ta đóng ở đây? Có khoa sách mới nữa hả? Okay. Sách của anh Đinh, sách của anh Đinh.
sách này là sách cũ xì chứ mới gì đâu.
Ủa, quay cái phiên bản này là hình như bản đầu tiên phải không anh Đinh?
Bản thứ hai, second edition, là có Win viết là giới thiệu trong đó đó.
Wow, hân hạnh quá. Sáng nay Huỳnh mời các bạn luôn nha. Ngày 29 tháng 10 này Huỳnh sẽ có nói chuyện trực tuyến với bên mà câu lạc bộ quản lý chất lượng về cải thiện giao tiếp với bệnh nhân. Huỳnh là một trong những khách mời đó. Vì cách đây một vài tháng hình như là có cái câu chuyện bác sĩ bệnh viện Nam Gác Chân mà anh Phú mới hình như tuần trước đóng rất là đạt á. Thì sau cái chuyện đó nó nói rất nhiều, và thực sự cái vấn đề này không phải chỉ riêng các bạn không, là cái kỹ năng giao tiếp là một kỹ năng cần phải học. Chứ không phải bác sĩ sinh ra là có, và tôi bảo đảm với các bạn là đây là một kỹ năng mà bác sĩ bên đây phải học dữ lắm, và cho tới bây giờ chúng ta vẫn học. Nếu các bạn nào quan tâm thì tôi sẽ gửi cái link để mọi người tham dự chung với tôi. Ok, rồi, chúc mọi người ngủ ngon. Anh Linh, anh Phú, Khuyến, thank you very much. And wait, Khuyến, any comments? Actually, why don't you tell us your impression about this class?
I'm very impressed. I really like this. Khuyến lúc mà Khuyến qua bên Mỹ, lúc đó Khuyến cũng 12 tuổi, thì tiếng Anh nó cũng là một cái vấn đề khó khăn đối với Khuyến, especially listening and talking. Nhưng mà cái đó thì giống như mọi người nói, cái đó phải tập thôi, chứ mình nếu mình mắc cỡ mình không nói thì nó sẽ là rất là khó khăn. And then một cái last thing là mình cũng là người quản, nhưng mà quản ngại chứ không phải là
wow.
Không phải Quảng Nôm.
Không phải Quảng Nôm. Yeah.
Wow.
But very nice to meet everybody. I really enjoy it.
Okay, so I hope you'll come back, and I hope you'll be part of VietMD too.
I will.
All right. Thank you, everyone. And again, this will be available on your YouTube channel. Okay, so I repost the link so you can go back tonight, listen to your voice. Okay. Bye bye, class. Have a good day. Thank you.
Bye.
Yeah.